Queen's nursing emerged from an idea in 1859 by English philanthropist William Rathbone, who wanted to support a group of nurses to work among the poor in Liverpool. After applying to Florence Nightingale for support, training schools across the UK were established, and Glasgow became the pioneer for district nursing in Scotland. But it was Queen Victoria's Golden Jubilee in 1887 that provided funds to set up the formal movement. Queen's nursing was born. The landmark Castle Terrace building in Edinburgh was secured for a separate Scottish institute in 1889 to train nurses to care for the sick and poor, with QNIS staff still working from there today. The Queen's nurses would hone their skills in the building's classrooms and in the community, equipping them for the future life on the district in tenements, houses and crofts across Scotland. The Queen's badge would be worn with pride as they took up posts as the local district nurse from the smallest island to the biggest city. They were pioneers, social reformers, taking public health into people's houses, helping families take better care of themselves. They were involved in all aspects of healthcare, a truly cradle-to-the-grave service, with many operating the triple duty of midwife, health visitor and district nurse. The Institute stopped training its own nurses following centralisation under the NHS, awarding the title for the final time in 1969. It then turned its attention to funding scholarships and bursaries to further nursing education and leadership, and to look after its retired Queen's nurses, with around 400 still receiving fellowship and welfare support. Building on a 125-year history, a vision to create a social movement of nurses who are catalysts for change in 21st century Scotland was evolving. Looking to our sister organisation, the QNI, who had successfully reintroduced the title to the rest of the UK a decade earlier through open application, a group was set up to explore how to return the Queen's Nurse title to Scotland. QNIS decided to adopt a different model using a nomination process. And in 2017, 20 outstanding community nurses were selected to take part in a development programme which would see them become the first modern Queen's nurses. You will find them working in communities across Scotland, bringing care to some of society's most vulnerable and marginalised groups, supporting people in mental distress, looking after our children, visiting families and schools. You will find them in care homes, on remote islands and in small rural areas, or in your local GP practice. They are there for families with loved ones needing end-of-life care. They take specialist healthcare to far-flung places, cutting down the need for long and difficult journeys. And while doing this, they all support colleagues to be the best they can be by bringing new ways of working. Each of them was chosen for providing compassionate, person-centred, community-based health and care to the people they work with. As Queen's nurses, they're following in the footsteps of the previous generation, sharing the pioneering spirit to improve the health and well-being of the communities of Scotland.